Have you ever been scrolling, maybe late at night, and you just stop on a health video?
Oh, yeah, all the time.
Yeah.
Some of them just explode online.
Exactly. Like this one we're digging into today, it had something like 300,000 views, thousands of likes. And the comments, people were calling the doctor a bodhisattva, like a living saint, basically.
Wow, that's intense engagement for what was the claim?
It was about drinking raw olive oil every day. This Dr. Hong was promoting it. And that's our mission here, to unpack that specific claim, really look at it closely, using the work of Professor Lin, who meticulously reviewed the evidence Dr. Hong presented.
Right. And this isn't just about olive oil, is it? It's really about helping you, the listener, develop a crucial skill. How do you look at these health claims, especially the ones that sound amazing, maybe too amazing, and figure out what's real?
What's actual medical evidence versus just, well, a good story?
Exactly. We need to understand what solid medical research looks like and why Professor Lin's sort of academic detective work is so important here.
Okay, so let's get into Dr. Hong's story because it was compelling. He talked about a specific patient, right?
A 55-year-old woman. She had chronic kidney failure and diabetes.
And apparently she tried diet, exercise, the usual recommendations, but her kidney function, her cholesterol, they weren't getting better.
Right. But then Dr. Hong introduces this idea.
Yeah.
20 cc of raw extra virgin olive oil daily.
And after just 3 months, supposedly her numbers saw significant improvement, big changes.
Which led Dr. Hong to declare it this, quote, life-saving remedy. And he started prescribing it to basically all his patients.
Okay, but how did he justify that leap from one anecdote to prescribing it to everyone?
Well, that's key. He claimed the video, his recommendation was based on extensive reading, organizing lots of medical and nutritional research. He even seemed to cite specific papers.
He did. For each of the 10 benefits, he listed cardiovascular health, anti-aging, you name it. He supposedly had a paper backing it up. It sounded really authoritative.
It really did. On the surface, very convincing.
But knowing Professor Lin's reputation for rigor, I'm guessing he didn't just, nod along. What was the first step in checking this out?
Professor Lin went straight to the source, or where the source should be. He took those 10 papers Dr. Hong cited and searched for every single one in PubMed.
PubMed, that's the big public library for medical research, right? Where you'd expect to find these studies.
Precisely.
Yeah.
He wasn't just taking Dr. Hong's word for it. He was verifying the actual citations.
Okay, so the moment of truth. What did Professor Lin find in PubMed?
Well, this is where it gets, frankly, astonishing. Out of the 10 papers Dr. Hong listed, 9 of them, Professor Lin couldn't find them anywhere. He called them ghost papers.
9 out of 10 just didn't exist.
Didn't exist in the medical literature database. It makes you wonder how someone could spend, as Dr. Hong claimed, a lot of time reading and organizing literature that seemingly isn't there.
Wow. That's not just a mistake. That's almost the entire foundation is missing. So what about the one paper, the single one that was real?
Ah, yes, the one survivor. It was titled Primary Prevention of Cardiovascular Disease with a Mediterranean Diet.
Okay, Mediterranean diet, not raw olive oil cure. What did that paper actually say?
Good question. Its conclusion was that for people at high risk, a Mediterranean diet, one supplemented with either extra virgin olive oil or nuts, lowered the chances of major cardiovascular events.
Okay, wait. So the diet worked. The diet that includes olive oil, yes, but also nuts, vegetables, fish, the whole package, not just drinking olive oil.
Exactly. That distinction is absolutely critical. It's the dietary pattern, not the isolated oil.
Did Professor Lin find anything else supporting that idea? That it's the diet, not the oil alone?
Yes, he pointed to another major study, the PREDIMED trial, which looked specifically at kidney function in relation to diet. And again, the benefits were linked to the Mediterranean diet pattern, not simply consuming raw EVOO.
So pulling it all together.
Pulling it together, the hard truth is there's currently zero research in the medical literature looking at the specific practice of daily raw EVO consumption as a standalone therapy. None. Meaning Dr. Hong's prescription
is entirely self-created. It doesn't have backing from the scientific evidence he claimed to have used.
And didn't he have some kind of odd disclaimer too? Something about,
Yes. The disclaimer was basically, if it doesn't work for you, it's because you didn't get the right kind of olive oil.
Which is convenient, isn't it?
Right.
Gets the blame.
It does. And this whole case really underscores why critical thinking is so vital for you. You need to verify sources, understand what real scientific evidence looks like, and be really wary of claims that don't have verifiable studies or that have these built-in excuses.
So the big takeaway here really is the value of Professor Lin's careful, systematic approach. It highlights this huge gap between a viral story and actual science.
Absolutely. It shows the power of just checking the references, doing that basic due diligence.
Which leaves us with a final thought, doesn't it? Something for you, the listener, to consider. Yeah. In this world just flooded with information, how many other popular health hacks or tips are floating around based more on someone's enthusiasm or maybe a single anecdote rather than solid, verifiable evidence?
How can you start applying this kind of critical lens, Professor Lin's kind of scrutiny, to the health information you encounter every single day? Something to think about.